Fit for Life Radio. I'm Gary.
I am Will.
We're with Coastal Strength and Fitness, and today we have a special guest with us, so you won't be bored. You might actually listen, and that is Lindsay Manzlak. Say hi.
Hello.
And Lindsay is with Wednesday Wellness. I almost said Wellness Wednesday. Wednesday Wellness, which right when I say that, what was that TV show or movie with the girl, like, and her name's Wednesday?
The Addams Family?
Yeah, the Addams Family. I think she popped
What a
in
weird
my
thing
head.
to forget.
Yeah, she popped in my head for some reason. But yeah.
Probably not the only one, honestly.
Yeah. So that's my association with Wednesdays, I guess. But now my association is going to be Wednesday Wellness.
Yeah.
I hope so.
Hope so.
So, Lindsay, tell us a little about your background and Wednesday Wellness. I think I find it interesting how you came up with the name as well. So maybe share that.
Yeah. So I'm Lindsay Manzlak. I'm a board certified women's health nurse practitioner. I've been working as a nurse practitioner for the past decade. I'm from Newport News, only ever left to go to school twice, and happy to be practicing in my hometown. I went to UVA for undergrad, studied nursing, worked for a few years, and realized like my true passion is in caring for women. Women are notorious for taking care of everyone else and just kind of putting themselves on the back burner. And so I went to VCU for my master's, and there's not a lot of women's health nurse practitioner jobs. If you could imagine, you kind of find where you kind of find a patient base and develop these relationships with patients long-term, kind of over the lifespan. And so there's not a lot of market for new NP, like women's health NP jobs. And so I kind of ended up in the gynecologic oncology setting, which would never have been on my radar, but it ended up being such a wonderful foundation. And it was very interesting to see how many women ended up in these, like, obviously very devastating, like with devastating diagnoses, and how they got to that point, being able to support them through that, through survivorship or even end of life care, but realizing there's still a role for wellness and overall health, even in the midst of something like that. I went on to work in a couple private OBGYN offices and loved the well women side of things and prenatal care. And that's sort of what I went into women's health for initially. And so it was kind of neat to be working in that capacity. I had a couple other children, and I struggled a lot from a postpartum standpoint, and just the way that the insurance model is set up. You really kind of have to get the most out of the providers that are in an office. And so most people going through insurance have probably noticed that your appointments aren't probably what your parents were used to, and being able to have these like longer, talking about more than just one thing at a visit. And so just a number of factors, and just in the fact of I had all the resources that you probably could have in terms of like the best doctors that I was with, but it was just too much as a mom of 3 kids. And I was fortunate to have the support of my husband, who said, we both can't be as busy. Why don't you take some time off? And, you work really hard to get to where you are, and then you realize like, I don't necessarily want to give that up. So I was fortunate to have the year break to kind of just step back and kind of evaluate what it is that I wanted out of life, and really still had this in the back of my mind, like wanting to take better care of women and figuring out how to do that, how I could possibly do that. I never, I always told myself, oh, you don't have a business brain, like you can't, but then since then I've kind of evolved. Like I've learned all these other things. Like I can learn the business side of things. And so now I just recently opened my own practice. It's a wellness-based practice based here in Newport News and Gather. Just a one-woman show for now. And it's kind of nice to be in that mode because I can still do my most important job of being a mom. But it's outside of the insurance-based model so that I can take the time that I want to with patients and focusing more on health optimization than disease management.
Yeah.
And so, the postpartum period, perimenopause, menopause, and just those things that there's not a lot of money in. And so insurance doesn't want to reimburse for it. And so those resources are limited within the insurance-based model. And so it kind of seemed like this pie in the sky kind of dream. And then I was lucky to kind of get involved with a group of women that are doing these types of practices. And so that kind of gave me the framework, but also the confidence to know that this type of care is wanted and it's effective, and being able to do things in the way that you want to has been, obviously it's still in the very early stages, but it's been so gratifying to be able to say, I have room for 4 patients on my schedule today instead of 28. And knowing that taking the time for women to be heard will go a long way, and not substituting for primary care or GYN. Like those resources are invaluable, and I encourage patients to find a provider that they can be, very transparent and open and honest with, because you need them, but they're not able to always, look at the big picture of things. And so that's where I come in. And as far as the name, I have always loved a Wednesday. Like, going back, if you cringe at some of your posts from, 15 years ago or 20 years ago on Facebook, and it's always like, oh, it's Wednesday, da, da, da. Like, always loving a Wednesday, but really getting to this idea that I want people to love their life as much on a Wednesday as they do on the weekend. Like, not waiting for the weekend, not waiting for a vacation to truly feel good in your body, feel good in your life, and do the things that you want to do. Also the tie-in of midweek and midlife, and so that's sort of where it stemmed from.
Yeah.
I like it.
There's also some great evidence and research too. Like, when people start things on the first of the month or on a Monday, there's actually worse success rates. And the reality is because it's a mindset, right? Like, you wait it until those days. And whereas if you just kind of start, say, on a Wednesday, it's a different mindset.
You're ready to get into it immediately.
So I think, and with this stuff, we know with wellness and kind of health span, trying to improve your health span versus just your lifespan, the solutions and such are things that you're going to need to do consistently and daily, and they're going to be maybe somewhat boring, right? Like, if Wednesday may be considered boring to a Saturday, right? But the reality is that is where the results are found. And then even deeper, hey, Wednesday doesn't have to be boring. You can really enjoy the process over time, especially when you start to feel and achieve some of the outcomes that you're looking for. So
exactly. And not waiting for the perfect time, and realizing you don't have to have everything perfect going forward or, in the process of it. I think that's a very, very good point.
Yeah. And then the reality too, this last 2 years with me, because I've never, went to the doctor, never had to go any injury, hospital, nothing, my whole life. And then my son's had some things, and we've had to deal a lot, which has also been eye-opening, that some of the things they're able to do have been amazing. But even then, it's this crazy stuff that we know nothing about. You can have these insane surgeries, and they sit with you for 5 minutes, right? You'll follow up, and then because they have such a high volume. And it's nothing like the doctors, their mate. It's kind of like the system, right? Even just now, we just had a call trying to schedule a dermatologist and scan, and the first appointment wasn't until January of next year, right? So, which and ultimately, that's just the whole system thing. The people care. Everyone we've come across has been amazing and caring, but you're very constrained.
Yeah, they have to operate in that framework.
And then the reality is, you have to be very. And with some of his health, to make sure you get this stuff scheduled, you can easily slip through the cracks. So you have to be very proactive for yourself.
Absolutely. And women, they'll make sure their kids had 5 haircuts before they even went to their annual exam. And, it's just kind of, you finally make the time to make an appointment.
Mm-hmm.
You finally get on this schedule. Then you get there and you either forget what you were like, you forget all the things that brought you in, or you don't have the time to talk about it. Or in a lot of cases, it just kind of gets brushed off. And you're like, you're telling me my labs are normal, but I'm sitting here in front of you telling you how I'm feeling.
Right.
And knowing that, like, you know, the whole gaslit term gets thrown around a lot, but there is a lot of truth to that, where it's like, then you start questioning yourself, like, am I making this up? But knowing deep down, like, no, there's a lot of things that are different. I know that there's a lot of things that I could be doing differently too, from a nutrition and exercise and all of that standpoint. But to be met with this like dismissal makes you not want to bring it up, and then you don't know you don't know what you don't know, and it's just this vicious cycle. So then you don't want to go to the doctor, but then in the meantime you're feeling worse, and
it's tough because like you could be someone who, you know, and a lot of the, you know, guidelines and all that are based off of like keeping people alive, right? So someone's blood work and results could be like, oh yeah, you're not on the cusp of heart disease. So, you know, but then the reality is they have a bunch of people who are, right? So, but then you're like, but I maybe I feel like crap, or there's these other issues. So that's where, you know, hey, you may have to take some initiative or take some extra effort to, you know, search a little deeper for some of these, you know, issues that you're dealing with. Or I guess what I'm trying to say is, like, they can be very real even if you feel like no one's saying they're not.
Absolutely.
Yes.
Absolutely.
It's just kind of like, because of unfortunately how you know, unhealthy and close to more extreme, you know, deathly type things, you're going to be a lower priority, right? Or these things are going to be a lower priority, right? And as a man, like, I've not experienced this, but I know if I did, I would start to be concerned. And it's probably not a high thing, but as you get older, what if all of a sudden you start to lose your, you know, sexual function and stuff like that? Oh, but you could not be at risk for heart disease. So that's probably something you're going to have to figure out for yourself, right? So then and unfortunately with men, it can be very obvious, right? With something like that, like, hey, you know, I might need these pills for this thing to happen. For women, it's not so obvious, right? So
correct.
You know,
how long do we have?
I mean, like you said, oftentimes, you know, the women shoulder a lot more various responsibilities, maybe in the household, right? And then, so like you said, and this happens to men too. Men are more likely to not say anything, right? And then that's a problem. And then women can just be doing so much, it just gets way down on the priority.
It goes on the back burner compared to kids and all
that.
Like
we've always said at the base of like exercise and nutrition, if you aren't at your best,
right, everybody knows that, but it's like, how do you actually do that in practice? And I was thinking about it recently, you know, whether you have kids or not. But for the example of, like, if you went to if you go to the pediatrician, yes, the pediatrician is much more knowledgeable of you, like of the things that could be affecting your child.
Yep.
But you also are with your child all day, every day. And similarly, like, you live in your body 24/7. And so, yes, there's all these, like, don't confuse your Google search with my medical degree, blah, blah, blah. To an extent, because you know your body. And so, but if you went to the doctor and they were kind of, you would have your mommy clause would come out, or your fatherly instinct would come out, and you would demand that they dig deeper because, you know, something is wrong with your child, you know, like, but when it comes to yourself, especially women, you don't have that same, you know, that same tendency. You kind of just, like, you either sit back and just take it for what it is. And then a lot of the things that are bothering women in this phase of life, it's like, it's not talked about. And now, thankfully, it is becoming more talked about. And when I launched my practice, I'd had some people say, oh, well, that's, you know, good idea. That's trending. And it's like, well, no, I memean, sure, it's trending in the sense that, like, women are speaking up.
Yeah, people are way more aware of it now.
And thank God that women are starting to feel like, wait a minute, it can matter. And it doesn't just have to be my new normal. And it's a shift because you are like a lot of women are known for people pleasing and all of this stuff. And sometimes when you have decline in your hormones, that kind of goes out the window. And that it's a good thing, but it can be a little bit of a shock to people that are used to, benefiting from women being people pleasers. And so then to say like, actually, this is a time where I really do need to prioritize myself. That's a very hard shift to get into, let alone logistically. Like mentally, you have to figure out like what it is that you need, how to do it, and then, and just feeling comfortable enough to figure out what it is that you need and then how to do it is a lot of the struggle. And so, and then when you're met with like, well, that's just how it is. Or,
that's a common one.
Or so for men from a sexual standpoint, we have all of these different options for erectile dysfunction and all of the things that men encounter. And for women, it's, well, have you tried a glass of wine? Have you tried a date night? Maybe you just need some lube. And it's like, hey, I'm not going to crave something that I don't enjoy or that hurts. So the libido side of things, that's very nuanced and there's a lot of factors to it. But if it hurts to have sex,
functionally,
you're going to want to, like, as much as you love the person that you're with or want to, and there are a lot of factors that go into that.
Well, then you could be insecure, and that right there could shut you down, right?
So. Disconnect in your relationship, and that could be a whole other episode for talker, but the fact is, like, there are a lot more direct ways for men to have that addressed, and if men were having similar issues to women, that problem would have been solved decades ago.
Yeah, there's a lot more available, like in an easier way for men for the most part.
Right. I mean, it's even mainstream, right? Like, it's not a taboo topic either.
Not at all.
People joke about taking the blue pill or what is that what it is? The blue pill?
Yeah. Or like, I mean,
there's a lot of pills now.
Getting on testosterone is pretty easy now to do. Like, you just go to your doctor and be like, hey, I feel like this. And boom, you're on testosterone. And that's that easy.
25 years old.
Yeah. That's just what it is.
All right. So we had questions from clients in our group. Like you said, there's tons of different avenues and ways. And even so, one actually before we dive in is also, let's go on the flip side sometimes, right? Where also even with your practice, like, and kind of that actually leads into it where, how easy it is to get some testosterone. It's not, it's so nuanced, right? So, and sometimes people, we have GLP-1s now, which can be very helpful, but also like, does someone need it? Do they need a certain dosage? Same thing with hormone therapy. But a lot of times, hey, someone may just really need extra accountability on, hey, maybe it is some of the basic stuff first and foundational things and then problem solved. But by having a coach and someone to help, guide them through even just those things, they've now, achieved what they were looking for. So it's not just about like max hormone therapy or rushing to these things.
Correct.
And that's where there can be a lot of different opinions on these kind of topics.
Yeah, all the things that are available. You can get pretty much anything that you want, but do you know what to do with it?
Yeah, and is it going to help?
And is it actually going to help? If you're not addressing like the root cause of things, and a lot of times, yes, hormones play a big part, but you can't just throw a hormone prescription at someone without addressing their inflammation and without addressing all the other factors that, it's kind of like a spider web. So if you pull one string of that, something else is going to be affected. And just because you can get hormones or GLPs, all of those things, like if it's mismanaged, you're not going to feel better. In fact, you might end up feeling worse. And then you feel like nothing's working for you. And then it just can be more discouraging. Yeah. And so a lot of times, and you probably run into this in the gym too, it's like everybody knows what to do.
Yes.
Actually doing it. But in this kind of more nuanced thing, there's doctors that don't know how to help you. And so why do you think that you would be able to figure it out on your own? And not to say that you can't take some ownership of like how to titrate things for yourself, but you have to have some background and you have to understand that there's not going to be one thing that's a cure-all.
Yeah.
It would be nice if we had that, but it would not be cheap, and it would not be, it's just not going to be as accessible. And really, truly, do you really want to just have one thing that you take and then it solves all your problems? Like,
yeah,
the things that are going to make you feel better, like, you have to have some buy-in to it, I think.
Yeah.
And like the GLP-1s, which, there's a lot going into that in studies, and typically the people who have the side effects and the negatives long term were people who didn't do it. They
didn't do it correctly.
And what people have to understand, this stuff's inputs. They're not magic pills, right? So the GLP-1 works. It's not like a magic pill that makes you lose weight. It helps your satiety and brain signals to where you then end up eating less, which then leads to weight loss. But if you just don't change your habits, don't do exercise, then it's basically another form of crash dieting, right? And then you end up losing a bunch of muscle, not getting enough nutrients over time, and you have a bunch of issues, right?
Like your bone health, and if you don't have much of an appetite, but you haven't worked on the habits that you aren't just going to have erased by that, when you want to eat something, you're probably going to go eat the garbage. You're not going to eat the things that you know are good for you unless you have that accountability and saying, like, you need to make sure you're getting enough protein, because otherwise you're going to have this muscle wasting. You're going to impact your bones. You might drop a lot of weight, but what kind of weight is it that you're losing? And you're not healthier for it. You have to address the habits,
foundation,
and the foundational habits and all of that. Like,
there's no
way around it.
No, and I think it's realizing things like that are still just a tool. That's it. And you have to be able to use the tool correctly. And you're not just throwing every tool at every problem. Like, you have to be able to implement a plan.
Absolutely. And every tool, there's nuance for every person. So the FDA approved weight loss medications were studied at certain doses, and there's like a regular recommended escalation of that dose. Well, a lot of patients that might not meet the criteria, so insurance isn't going to pay for it, number one, but also, like, you might not need blasted with this much of that medicine. There's a lot of promising research about like microdosing them and just getting like a whiff of that to help quiet the food noise that is like very real and very impactful, but also still needing those foundational habits. But, you're not going to find a lot of providers that are doing that because, number one, reimbursement, and just not having the training and not feeling like comfortable because research is lacking. And that, I think we talked a little bit about that. Just there are differing opinions on the way that perimenopause and menopause and even men's health is managed because of the studies or the lack thereof. But if you waited for studies, you would, it's generations.
15 years.
Or more. And so in the meantime, you're just supposed to suffer when maybe this might work for you. And, being very, like, this being my specialty and the thing that I've chosen to work on and have mentorship with and all of this continuing education, like, I feel comfortable, like, safely coloring outside of the lines. Whereas if you are, accountable to an insurance company and those sorts of things, or having to do like prior authorizations for medications that probably would be helpful to a patient, but you can't, back it up with these gold standard studies, but knowing what you know about the physiology of things, like, this might actually be very helpful for this specific patient, not her friend that's at happy hour talking about the same thing. They might need something different. And that's where you have to learn how to advocate for yourself, but also find the right person to be looking at it.
And there's a huge individual component, right? People respond differently to different things. Yes. And, studies and all that, there's always little dots all along, but it's taking the average. But the reality is you could be someone who's way up here or way down here. In exercises like that, you can take, 20 people and give them all the same program, and you're going to get 20 different responses, right? And that matters more with specific things, right? But you see it like sports is a great example in that, like, most elite athletes, the sport finds them, they don't find the sport, right? Based on, like, people used to think, remember, like, if you do, all these elite gymnasts are short, and they thought, gymnastics must stunt your growth.
Like, no, they're just good at it.
The people who of that body type tend to favor it, right? Or when people are always like, swimming gives you broad shoulders. Like, no, but tall, wide, long limbed people happen to be great at swimming, right? Even on a more extreme example, like professional Olympia bodybuilding. That really, they actually say, it's actually who genetically responds to the steroids the best, right? So it doesn't even it's like some people just the anabolics, their body genetically responds really well to building muscle from them, right? So so the same thing's going to happen on a like you give someone a little bit of estrogen or a little bit of testosterone, how do they respond, right? And then having someone to actually guide them through that process and see
and having that close follow-up instead of
just like
6 months or
exactly
refill and have it mail ordered. And again, not to there's great that there's that accessibility, but the majority of people need guidance, myself included, like anybody. And and that's just from a safety standpoint and just actual usefulness.
Yeah. And remember, most people, and we know this, don't even know. You ask them to name, you give them 10 foods and say, tell me if this is mostly a carbohydrate, a fat, or a protein. People don't even know that.
Yeah.
Right? So how are they going to know? And the problem is people can read stuff and know 10% of things and then feel confident when they're, shouldn't be.
Right. And there's a lot online, and who knows how the algorithm works to see what gets in front of you. But it's really hard to discern, who's selling me what? What is this person trying to sell me? Number one is kind of how you have to go. But there's a lot of really good information out there too. And thank goodness for that, because otherwise you wouldn't feel comfortable speaking up and being like, yeah, none of my labs are flagged, but I still feel like crap.
Yeah.
Help me.
And I think that's valid. And because a lot of times people get brushed off because the numbers are fine. Well, it's well, I feel terrible. So something's wrong. And then, like you said before, people feel like, well, am I just making it up in my head? Do I actually feel fine? And I think that's how a lot of people feel. And then you don't want to seek it out anymore because you're like, well, it must just be something wrong with me. I just need to adjust my mindset. And that's a problem.
Yeah. And it can be so discouraging, and it can limit all the other things that are good for you because you're feeling like, I'm doing all the same things. I'm trying to eat the way that I am. And you're sitting here telling me that I must be lying in terms of my food recall. No, there's biology behind why this calories in, calories out isn't working for me right now. There's things that you can't control for just on your own. You can't muscle, just like you can't out-train your diet.
Yeah.
You can't you can't supplement for the things that are declining in your life and your body, just biologically. If you're that's the thing too, is you may or may not have children as a woman, but you will, if you're lucky enough to live long enough, you will go through menopause. And it doesn't just affect the 51% of the population as far as women, because you guys have women in your life that you care about. So it affects everyone.
Yes.
So it does everyone, it behooves everyone to care about it, because the people that you care about that are really helping you through life, they need your help. And if we have men behind that whole thing, probably will get more traction quicker.
Agreed.
And again, not being this ultra feminist, anything. I love the role that men have in the world and in life, and it's a balance. But the fact is, women can't get there on their own.
Yeah.
Mm-hmm.
And there's a lot of factors that are new that this generation of people and are experience. First, we're living longer as a whole. Yeah. Then also we've had this food environment that's changed, and the kind of environment of stress that's 24/7.
Yeah.
There's a whole generation of women that were taking birth control when they were younger, which can affect possibly menopause down the road, and
we're outliving our ovaries. We didn't used to outlive our ovaries, and so even as the lifespan gets it gets longer, that's great. We don't know evolutionarily wise why we outlive our ovaries now. We do know because of all of the advancements, but what do we do with that? We don't just we're not meant to live
Evolution only
50
cares about
years.
reproduction. So evolution probably only evolved us to live to be able to reproduce, right? Which was really, you did that in your like,
But now, yeah, but now there's this
they don't really probably care about you after 30.
there's this there's a grandmother hypothesis where it's like maybe we're living long, like maybe women are outliving their ovaries so that they can pass down the wisdom of what they have learned in their life experiences to the next generation and helping care for those. And that's a whole other like sociological thing, but there's a reason that we're living longer. We don't necessarily need to know exactly why to know that we have a lot of work to do to stay as healthy as we can. Because to your point earlier, like lifespan versus health span, you want to be training for how you want to be functioning in your 70s and 80s and beyond. Not like, I think a lot of people are getting out of the mode of like just how you're going to look on the beach this summer. Like you're training for your, for your older self, and that all of the things that you guys do and how you program the workouts, it's all functional, and it's all for the greater
the big picture,
good of your whole health span, and not just losing.
And I want to look good in 6 weeks.
Correct.
Yeah. And a lot of it's like new technology that we've learned, right? And maybe it's like, wait a second, if we can manipulate some things and when you're in your 60s and 70s, you can thrive, quote unquote, more. It's kind of the cusp of learning and experimenting with that, right? Just like we did with automobiles and computers and all that. So, and I think that's what makes people uncomfortable too, right? It's like, this is new, so that's where it's, it depends on your personality and if you want to wait or if you want to be someone that tries things out. But at its core, you have individual people in their very real lives who feel things, and that can, people want to feel better, right? So let's go over a few questions. Because if one person has a question, it means a lot of people have thought the same question. So
that is true.
And again, with all this, there is nuance. There's tons of nuance. So don't take anything, or like we said, ultimately everyone's an individual. That's a big piece of this. So
none of this is
like general advice. Yeah.
I'm a nurse practitioner, but I'm not your nurse practitioner, and so there's a lot of it's hard to make blanket statements. And that's another thing is like, there's really not many absolutes in medicine, especially.
Yeah.
And so if you're finding that you're encountering a provider that's saying like, oh, absolutely not, this is not, you're allowed to challenge that in a respectful way, like in a collaborative kind of respectful way, but there's really not absolutes to things. So
yeah,
that's important to know.
All right. So one question. This is a good one to start. I won't say people's names because I don't want.
Nah.
So, are there ways we need to change our exercise routines as our bodies change?
I would think we could all say yes to that.
Yes. So, and now the thing is, the answers to this are becoming the opposite of what most people intuitively think. Right. So, which is going to be, this is why, obviously this is a big thing for us is yes. And it's technically no, because you should be doing these things when you're younger. But, this is where resistance training enters the chat. Right. And we think of it as, it's something we want to do when we're younger, or because someone might want big muscles, strong muscles, it can be associated with, attractiveness and all this, but, I don't care about that. I'm not trying to attract a mate, right? Why would I? And I don't want big muscles. That's bulky, right? And unfortunately, that was what was sold in the thought process to women specifically, almost forever, right?
For too long.
And so they didn't do it. They avoided it, right? And the thing is actually, when we're younger is actually when we are naturally more active. Everything's in our favor as far as our hormones. Recovery and just the ability to build muscle. So we actually need it more as we age to combat the steeper declines of of if you don't use it, you lose it.
Yeah, like the known muscle loss that comes with age and declining hormones and things like that. So it is good to have that foundation. And I feel very lucky that I had that like for as long as I can remember. I've been working out, and not because it's a chore, but because of how it makes you feel, and realizing like the benefits for your mental health, your heart health, your bone health.
Yep.
That doesn't change. That part doesn't change as you get older, but it becomes more important. Like you have to actively maintain your muscle mass, and you have to actively be doing things for your bone health in terms of weight bearing exercise. And you want to be, working on mobility things, and you want to be able to get up off the floor.
Yep.
All the functional things and working on your balance, because if you break a hip when you're older,
That could be it.
The recovery and all, your ability.
I don't want to quote this statistic because I'll probably be wrong, but there's a high likelihood of mortality in the first year after you break a hip.
Yeah.
So all the things, your muscles matter, your bone health matters, obviously, your balance, all of those things tie into preventing that.
Coordination.
Yeah, all of those things. So training in that way, and again, not doing it for 6 weeks because you want to look good before vacation, but knowing that this is all like my insurance policy for who I want to be and how I want to be functioning when I'm older.
Yeah.
And that should be like motivating and exciting, not daunting. And it's not too late if you've always done like just straight cardio because that's the generation that you grew up in. Like, sure, that's beneficial to an extent. Your heart needs that, but you can't substitute for.
Yeah. I think the problem with that too is more because, you do want to have these aerobic, efforts and stuff. I think it's the mindset behind it that really needs to change. Like, so the question is, do we need to change our exercise routines as our bodies change? And really the best way to look at it's like, we need to change our mindset around exercise and stop exercising to lose weight. Right? Because when people do that, then that's when you chase sweating, you chase the calorie burn, you chase fatigue, which is typically let me just do all these.
Drive myself into the ground.
Yeah. And the reality is, you need to actually chase strength, chase balance,
recovery.
Right. And understanding your recovery is different than when you were 30.
Yeah.
And your recovery is different from the person that's working out next to you at Coastal or wherever you are. And you don't need to kill yourself every day because you're not able to. That's a stress. And you guys have talked about that a ton. Yeah. Like, you have to be able to recover from that. You can't do the workouts that people are doing that have nothing else to do in a day.
Yeah.
It's a stress to your body.
It's the fitness fatigue model, which like we described is any exercise you do, there's a certain amount of fitness adaptation it can trigger. And there's also a certain amount of fatigue. If the fatigue outruns the fitness, you will not get the adaptations. You will not see the benefits. You'll just and then eventually
you just grind yourself down.
And so what does your body do to help stop that? That's then when you get injuries and it breaks down. That's how it stops you. So you have to balance that. And the reality is, as you get older, the fatigue part gets more. You got to monitor it more. You can't just. Look, you can see the difference. And when I was 21, I could drink 6 beers
right.
and be, now if I did that, I'll be out for 6 weeks.
Yeah, that's it, dude. Hanging up.
So it's just like your body, doesn't recover as well. So that's how your exercise routine needs to change. I'll make a strong argument that
it should stay the same.
You should start like that, right? Now, if you have sport, that's a whole different thing, right? You have hobbies and sports that are outside of that. You're now accepting trade-offs, and which is fine because we're all living and choose, things we want to do, right? It's just the same thing with anything, right? Alcohol, whatever it is. Like, you don't have to be a monk, but have some framework, and then be aware when you are stepping outside of it. And as long as then you've accepted those trade-offs. And
understanding that what made you feel good and what you liked and enjoyed earlier on in life, it probably is going to change. And it can be an adjustment to be like, well, I really loved the endorphins that I got after I did that very hard Metcon.
Yeah.
But then if you take the time to appreciate a walk in the sunshine, that seems so hippy dippy and whatever, but it shifts, and like chasing your slow dopamine instead of this quick dopamine that we're inundated with, like those sorts of things all can impact your heart rate variability. And there's a lot of great research in that. And it's in your overall health, your inflammation and your stress response and all of these things. And not that you need to get bogged down in that, because that in itself can be like debilitating.
Consuming.
It can like just stop you in your tracks. So, you know, you're hearing this and this and this, you know, like all of these varying things, but the majority of people are going to do better, like middle of the road.
Yeah.
And that's great.
Like most things. Yeah. And it's
and
hard.
This is the thing I've always said, and people don't like to hear it, because then when it clicks for them, they're like, oh yeah, you're right. Is for a lot of people, yeah, you get that short-term boost with, say, the, you know, hardcore Metcon. And that's, even though it's harder in that, like, the exercise is harder, more challenging in that moment, that person though who loves that stuff, doing the, you know, aerobic or light walk is actually harder for them. So no, you're not doing the harder thing. You're not challenging yourself by choosing that other route over and over and over, you know? So then it's like, you know, that would be, the slow walk is actually harder for that person. So
you mean like physically or mentally, or just all of the above?
like all of the,
I think if we did a sum of all of the
sum of all the above, right? Because they have trouble doing that. It's hard for them to stop and do the easier thing, even though it's what's better for them. So they're actually, so what I'm saying is, like, you can say that to try to like play, you know, get them to look at it from a different angle and be like, oh yeah, I need to do more hard things, right? Well, that would actually be the, like, for example, a lot of people that I know that love to do hard 75, they're actually people where like an easy 75 would be harder for them to do, you know?
Right.
Yeah, just go for a walk
it's
every day.
Comforting to do the all or nothing.
Absolutely.
You know?
And I mean, I could even speak to that. It's harder for me to like set a timer and sit on the couch for 5 minutes. I would rather like busy myself, or it's just like ingrained in me. And that's not exactly a similar, you know, comparison, but it is like, it's a lot harder
to relax.
To do nothing is difficult.
Especially as a woman, like, how am I to do nothing? Like, I still have that ticker in my brain. And so figuring out ways that you can turn, and a lot of times for most people, like, meditation is a lot harder than.
That's another one for people like, oh, I can't do that.
Right.
Well, it's like, it's too hard. It's like, well, you probably should.
Then you need it.
And then, like you said, it's in his way, in short term, long term, stuff like that. So, and it's all, you always have to fight it. Like, I saw a guy who's like one of the high ups and randomly on Instagram, and he's does a high Roxas, right? And yeah, you see some of that stuff in the moment, and you're like, that's so cool, and I would want to do it, and maybe I should do it, and it's something to train for. But then, you know, you scroll a few, and like, he's in a boot, and then you forget, oh, wait a second, the people that train for this, in the clips, it looks cool, right, when they're on the podium and doing all this stuff, but you also, do I want to, like, is he, you know, dealing with debilitating pain every day, pushing through it, and all this stuff? Yeah, exactly. And it's like, you know what, you know, I'm good. I'm good. Yeah. You know, I have no pain, and wake up and do it. And so, you know, it's, you have to step back and think big picture. So that's question one. Another one. So this one's harder to answer. The first one was a softball. This one is understanding myths versus facts and risks versus reward when it comes to HRT, hormone replacement therapy. I have some of the symptoms associated with perimenopause, tested low, and given treatment by GYN, but oncologist says absolutely not. So now what?
This is like my wheelhouse. So this is actually
good.
This is like,
it's not ours.
Your avatar.
Especially having the GYN oncology background. Like, there are no absolutes. I would question, have both of your doctors talked to each other? Because yes, you're the middleman and you're that, but like, they need to talk to each other. There's this whole idea of like peer to peer and looking at risks versus benefits. And everybody, of course, like, nobody wants a cancer diagnosis.
Yeah.
The fact of the matter is, thankfully, a lot of women are surviving breast cancer, and they are faced with symptoms that are a side effect of either the treatment or the current things from helping prevent recurrence. And so if you're having, for example, like vaginal dryness, even there's just this week, that came out as far as guidelines, as far as shared decision making. If you were diagnosed with a cancer and you had treatment and you're in your 40s and you have pain with intercourse, risk versus benefit, knowing that this is like a very, very, very low dose and it's not going to be systemically absorbed, being able to say, like, that's a risk that I'm willing to take if I'm able to now have, like, not have uncomfortable intercourse. Like, that's a big part of my life. Like, of course, I don't want my cancer to come back. And of course, we don't want to do anything that's going to put you at higher risk for that. But even if there's a slightly increased risk, ultimately it's up to the patient to say, like, that's a risk I'm willing to take. I'm still going to be following up with you regularly. And I count on you guys both to be monitoring that. And obviously, like, I know my body well enough going through this whole journey to know when something is off. Of course, I don't want to be reckless in that sense, but like, can we revisit that? Can we not just take it all, like, gatekeep from that standpoint? Because the medications that we had even 10, 20 years ago are used in a different way than they are now. And thank God for that. But you might have to probe them a little bit more to say, like, can we please talk about this? And can you not make a blanket statement or assumption? Can we, specialists, when I was working in that mode, and it's even still now, like, I'll be the first person to say, like, please weigh in on that because you know more. But also being able to have a conversation and saying, like, really, when we're looking at this specific patient, like, yes, you might see this research paper that scares the heck out of you and you're worried about your license and all of this. But ultimately, at the end of the day, like, this patient that's sitting in front of you has a whole life ahead of her. And thank God for that. And thank God that you were able to get her to a place that she's, more stable with regard to that disease. But look at her whole overall wellness.
Mm-hmm.
And if you're not willing to get a second opinion or a third opinion, and not just feel like your concerns or your desires are invalid. I don't think that anybody who's looking at the big picture is going to say, like, you're wrong for wanting to feel better in the day-to-day because what if this? Like, you can't live in fear. You probably already do live in fear. Hopefully you get a different perspective where you get to a point that you're not constantly worried about this recurrence in the back of your head, because you know that the recommendations that your oncologist and your GYN are making in terms of surveillance are with you in mind. You're not just in the deep end by yourself. And that's just makes me want to shout it from the rooftops. Like, please don't take no as the final answer.
Yeah.
And understand that, like, you're multifaceted. You're not just your cancer. And I could get emotional about that. And I'm so glad that question was asked.
Yeah. So now what? Get another opinion.
Or just ask the two doctors to talk to each other.
Yeah. Yeah. Because sometimes they're just going off of,
Look at me as a patient. You're allowed to ask that. And the doctors that are, even if it takes them a little bit more time, like, most doctors do want the best for their patients. Like, they still do care about you as a person. There's a lot of factors that impact what their recommendations are. And there still may be reasons for their hesitation, but having a better understanding.
Yeah.
And then looking at alternatives to the things that you're experiencing, because we are lucky to live in a time that there are probably other alternatives if you really shared decision-making wise say, like, I don't know if I want to take that risk.
Yeah. It's a perfect example too, because, not with that yet, ask and have them collaborate more, so with some of the situations with JJ, he has a neurologist for the spine issue, and then there's some bladder, issues. So there's also a urologist. Well, when his MRI first came back, they thought they saw some things, but they were like, "Oh, we'll just monitor it. It looks fine." And just as he gets older, we'll see, because he didn't have certain symptoms. He was still able to move his legs, do things like that. And literally, we were like, "Oh yeah, it's not tethered." relief. And then like 2 hours later, the urologist calls and she's like, I'm looking at it. And she's like, no, I see this is tethered. I think you should have a urinalysis test to see if there's any actual, even though you see him peeing and pooping, like and we did, and then and it was, and he had bladder dysfunction or from nerve damage from the tether and it showed those tethers. So then they're like, oh yeah, like yeah, we need the surgery, right? And he got the surgery, and when they got in there, confirmed, and and then the good thing is now, like, it's untethered. He's not gonna have more new nerve damage. But there is some nerve damage from what. But could you imagine if we went off of the first opinion? And they really just came down to, like, they probably have a bunch of MRIs they just did, and they're going off the list. But luckily, it's almost luckily we had this other problem to where she was even involved, Right. But then the reality is and of course, we were pissed because someone called and said good news and then bad news. But then they were like, hold us, let us talk, and we'll get back. And yeah, that's what they did. They were kind of forced into it.
But they still did it.
But they did
which
it.
Is
but
good.
Then you get another expert's opinion. You get pros and cons weighed.
Of course.
And then we actually come to find out, like, yeah, and here's the thing. It's like, so the original kind of diagnosis was wrong, and waiting would have been a mistake, because then he would have had more and more and more nerve damage as the tethering pulled tighter and tighter as he grew. And yeah, you think, and again, it's nothing.
And you don't know what you don't know.
Yeah.
As a new parent.
You're like, okay.
Yeah.
So, and again,
you're the expert.
Yeah. And this stuff is hard. It's like we said, it's nuances, individual. They probably have protocols for a tethered cord, but every tethering probably a little different.
Absolutely. We're not textbooks.
Yes.
And I worked with some great doctors, like when you're going over their consent forms before surgery, like your anatomy is probably going to has the potential to look different than a textbook that I've studied from. And so these are the risks associated with your surgery. And to your point about, like, there are a lot of specialists, and sometimes that's a great thing. But sometimes as a patient, it can be frustrating to feel like your care is so segmented. And in perimenopause, when you have some of these, like, not as classical symptoms, you get the runaround. You end up going to the neurologist or rheumatologist for your joint pain and all of these things, when somebody that looks at that from the big picture is like, oh, well, your joint pain could be that, but also it could be related to a decline in your estrogen. Yeah. And so a lot of times, and I forget the figure, I don't want to be holding myself to a statistic, but like almost a dozen providers before you get a diagnosis that it's really truly not just perimenopause, but is likely just because of that. Because all of these things, it's a diagnosis of exclusion, but not being afraid to say, like, I'm more than just the sum of my parts. And yes, you need, like, you wouldn't want me being your cardiologist. That's not my specialty. However, there are things that I can lend to a cardiologist in terms of the overall picture, and being able, like, doctors are smart.
Yeah.
And they
be like, and you know what? This actually new information comes in, and
let's look at this together and do what's right for this patient. And it's not rewarded from an insurance standpoint, and that's a whole other. Yeah. But it doesn't mean that you can't.
And I think too, they'll sense if it's important to you and you're really pushing, then it will become more important to them, and they'll maybe, hey, let's
dig a little deeper.
Gosh, when you do have a great outcome because they collaborated, how gratifying is that?
And I say that as, like, even their baseline could be 100% care. That's how it is at the gym. We care about all our clients. But the reality is, and we even say this to people when they sign up, or especially if they do something like nutrition coaching, like, the more you communicate, the more you're going to get out of it.
Yeah.
Right? Because at the end of the day, it goes both ways.
It's still it's a collaborative thing.
The reality is, so I think that's a great way to look at it in the question, and it's like, ask for more, ask to communicate, just get, like, make it easy for them, or even if it's bugging them, whatever, like, most people that are in this business do care, and the more you care, the more you'll probably pull that out of them. Mm-hmm. So,
because I think it is challenging when, as the provider or the person, in that position, like, you can care and care and care, and if you get nothing in return over the long term, I can see how that can burn you out to where you're like, well, I can't keep giving myself if I'm getting nothing in return. Mm-hmm. So when you do get that, it is rewarding. It is reinforcing that, like, okay, there are people out there that are gonna meet me in the middle.
Yeah.
reciprocal kind of relationship.
All right. Question number 3. Where does a woman start with navigating hormones? GYN, primary doctor, other specialist. Then also, so bunch of questions.
We could start with that.
Okay.
Don't ask at your annual exam. It's tempting because you're finally there and you know but you really don't have the time to have a
not on
appropriate
the
discussion.
Okay.
So making a separate appointment, you could also ask ahead, at your annual, do you feel comfortable having a conversation with me about these symptoms that I'm experiencing? Don't want to have the discussion today because I know that there's a lot that goes into it. If not, who would you refer me to? And not to have a plug for myself, but I'm happy to see anyone that wants just even a second look at your labs or, that sort of thing. Finding someone that has a special interest in it, because the fact is, when you're as busy as you are as a provider and you're doing whether you're primary care or even GYN, there's a lot of different facets to both of those specialties that you might not have seen the guidelines that came out this week. Whereas this is what I'm choosing to do as my life's work at this point. And so being able to have that time. But if you have had a full clinic day and then you have charting and you're on call and you're going to deliver a baby, you are up to date on the things as far as the surgeries that you're doing and doing appropriate and safe obstetric care. It may not be a special interest of yours. And so that you may or may not have a provider that will admit to that. But if you, you could say you could ask that question. And there are a lot of great providers that are willing and wonderful at doing that. And so you'll get a sense of when they talk to you about your options, and again, not getting into absolutes. And then, it may not, just the first time that you have a conversation, it might not be all that you need. And if it doesn't feel like the most productive, then you can look elsewhere. There's, a lot of primary care doctors probably do it to some extent, but I think a lot of them feel more comfortable with GYNs. And then there's, again, these cash-based models that are coming out because it's focused on optimization and not just disease management. And so I think being proactive in terms of having a little bit of background and also tracking your symptoms before you sit in front of someone. So you can say with hard data, because a lot of times you get to a doctor and you're like, I've been feeling like crap, but specifically what is going on? What is the pattern of that? And what are you noticing in that sense?
But what if, have you been sleeping for 4 hours a night?
Correct.
You're going to feel like crap. So.
But there's a lot of factors that impact your sleep.
Right.
And so, but being able to say
the data that hey, this is my sleep
right
per night and something's affecting it. And I do all this sleep.
Work.
Yeah.
And
just be guessing. Yeah.
Yeah. And don't, to your point about what you put into it is what you get out. You don't have to have a binder full of things, but having a clear understanding of how you're feeling and prioritizing. That's the other thing, is figuring out, you might have a laundry list of things that are bothering you, but prioritizing what are the top 2 or 3 things that are bothering you and how maybe treating one will help with the other. But yeah, I think those are fine places to start, but don't feel like you are at a dead end if you don't get as far.
Yeah. So, and I think that's a great, helpful answer, because it's a simple place to start, right? Most people are going to have that meeting, but that their plan to do basic stuff, they're not going to have the time to go deeper, right? But you're now raising your hand, and kind of, making it clear that you want a next step.
Right. And also, depending on the provider that you see, they may or may not believe in doing your labs. Yes, there's there's the position statement from the Menopause Society is that you don't need labs and you shouldn't be doing labs for the management of that. But there's a lot to gain from that. We do it as providers, we do that all day long. So we know that there's fluctuations in perimenopause. And we know that drawing it one day, it's going to look different the next day or the next week. And that's normal.
So you could take 4 drawings in the same day.
Exactly. From a cortisol standpoint and all of that. But also that just also says you may or may not know how to interpret that data. And you can also, it's a great time from a midlife standpoint to be looking at your lipid panel and your A1C as far as your diabetes risk, all of those health prevention things that once you're done having babies and you don't go to the doctor for years and years because you're feeling fine enough, may have been put on put on hold. And so it can uncover things that are also impacting how you're feeling. So
cool. So then the second part was, which this is a great example we talked about earlier, how problem with like there is so much information, you can kind of maybe learn something, but it could also do more harm than good.
like this might not be what you need.
Yeah, and then they mentioned, so then they ask also what vitamins or supplements are helpful. Calcium is a common one, but what else? And I know in general, most people don't like to hear this, but most vitamins or supplements are actually not helpful, or especially to what people hope they're going to do. There's not a ton of like vitamins and minerals in supplemental form that over time, you know, make a difference. And then problem is, and then specifically they mentioned calcium. I don't know specifically with like perimenopause and all that, but they're more common, the general consensus with calcium as a supplement is that it's actually could possibly cause more harm than good, because they had these women blasting calcium for all these years, but then they realized, oops, like
we need some other stuff.
The calcium can literally cause the buildup, you know, depending on where it's getting stored. These other things like vitamin D need to be with the calcium so that it gets put in the right places. So by taking the supplemental calcium, you were almost fast forwarding some negative things. So you have to be very careful with supplements, right? And then also too, I think a lot of people hope that the supplement is going to
cure whatever.
You know, you see this in the men's world where like guys want the results of testosterone from like an over-the-counter supplement, and it's just like if that existed, it wouldn't be $39.99 a month, you know? Yeah. So, where, as I guess a base starting point, do you stand with that? Also, vitamin supplements, are they helpful?
yeah, so supplements, just in the name, it's a supplement to what else you're doing and the things that you're eating. And a lot of times your body absorbs the nutrients that you're trying to get from supplements through food better. And so
there's a matrix, the food matrix.
And fiber. Maybe people don't maybe think of that as a supplement, but that can be very helpful from a lot of angles. There's a lot of focus on protein. Like you can't go 2 steps without seeing or hearing about protein. But
I actually think of like fiber and protein powder not as supplement. They're food. I think of them more as food. I put them in a different category, food supplements. But
but omega-3s for your heart health, vitamin D. Most of us are deficient in vitamin D to some extent, especially coming out of winter. But you want to make sure you know what your vitamin D level is so that you know how much to supplement.
Yeah, so you're not blasting that.
Exactly.
And same thing. It's like depending on a different factor. Sometimes it's the points like your blood values would all typically tell you, right? Like your vitamin D level. So then you would know if you need a supplement or not. So I think most things are like, don't supplement something if you don't need it.
Yeah, if you don't know, don't just throw everything at yourself.
Yeah.
Even you know, like iron, there's some thought that might be impacting brain fog that you see in perimenopause, but too much iron can cause issues too. And so it's a fine line, and you don't want to just, again, like blindly supplement without guidance.
You might create problems.
Right. And, you know, collagen, creatine, those things that you think like are kind of fluff, but really can make a difference. There's some studies that are coming out in terms of creatine for cognitive function, and just obviously we know from a muscle standpoint.
We're big fans.
Creatine has the most research and is
it's very thoroughly researched.
And but things like turmeric and berberine, those help from an inflammatory standpoint. But again, you kind of want some guidance there, and not just. And I would caution like where you're getting your supplements from too, like making sure it's from a medical grade place. Amazon, you don't know what you're getting. You want to make sure it's third party tested. Even still, it's good to be a little skeptical, and also understanding like you're not going to feel 500% better. These are things that you would take regularly for a long time. It's not going to happen over.
It's not going to change your life overnight.
It's not going to do the trick. And so you can go down a rabbit hole with supplements to the nth degree. But having a good baseline from that end, and obviously like B vitamins help from an energy standpoint, but you can also there's B vitamins in everything because it's and so you can end up like way up here on this, you know, on the level that you don't actually need. And then you're just making really expensive pee.
Yeah.
Yeah.
But that's a lot of supplements.
Yeah.
You just get some good pee. That's it.
Right.
Yeah. So is there a connection with calcium, or do you think she had maybe just heard it was a general supplement? Like there's nothing that comes to mind, like why they would ask about that.
I mean, from a bone health standpoint.
Yeah. But with calcium, you should try to get it from food.
Yes.
I don't even think you should say, well, I would, just make different food choices. And it's almost too risky to supplement with calcium unless you are monitoring your blood work and making sure you're having enough vitamin D, because it's just,
you can end up with deposits.
Yeah. So, and calcium, well, I shouldn't say easy. If you do dairy, it can be easy.
Yes.
In leafy. A health promoting diet, you should be hitting your calcium, right? If you're getting leafy greens,
getting your fiber too, and
dairy,
you're staying fuller longer. It's not sexy, but it works.
Yeah.
It's not going to sell because there's nothing to sell.
Yeah.
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 And let's see. I think that is it. The good ones. Good ones for like starting. Yeah.
Standpoint, I think I saw a question in that regard. We know that when you have less estrogen, then this goes to like your blood vessels and things, they become less flexible. And so estrogen can help from that end, but also all the whole discussion that we had about how to modify your exercise and not being like allowing for recovery, but knowing that you may be at increased risk of things like tendon injury, and frozen shoulder is very common in perimenopause and menopause. And a lot of times, supplementing with estrogen. But again, I wouldn't make a blanket statement that everybody needs to be on it. That used to be the thing. It's like we got to a point where everybody needed to be on estrogen and progesterone. And then there was this poorly designed, even more poorly reported study that said, oh, no, nobody should be on it. And then,
swing the other way.
Yeah, and really what we know, just like anything,
it depends.
It depends on you as a person. And that's a good thing.
Yeah. Yeah. And that was actually, looking back, the original post in question was along those lines of someone experiencing more injuries and whatnot with possible shift in, their hormones and as they get into a certain stage in life. And they also mentioned, maybe this was where the supplement question that did come up, that some additional supplements to help. But again, with supplements, they're like she said, there's some creatine and omega-3 if you're not eating fatty fish that may help, but they're not necessarily going to like fix or substitute. And in general, it's always would be better to find a whole food version of them, because ultimately the problem is with this is kind of like you passively mentioned calories in, calories out. It's just an underlying principle, but a lot of things affect those calories once they go in the body or then the out portion of what's going on, right? So, for example, you could do a workout and the amount of calories you burn could be different based on your hormones and what's going on. And and even this is where we're big on it. Maybe the root of this question is like, which is a reality you also have to face, is we don't recover like we do when we were younger. So if we try to do more or ramp up our volume, one of the biggest things is with exercise, a lot of times is like people's programming can cause problems.
Yes.
That is a factor too, right? So
especially if it's random.
Yeah, if it's random and if you're doing as much as possible.
Yeah.
Like we said, it's the fitness fatigue model. And if the fatigue is outrunning, it's going to lead to injuries, right? So a lot of times we also have to step back. And this is a hard thing as an athlete, right? And I was an athlete, and you see it with elite athletes. Like there's a reason, you watch pro sports and like look at NFL, right? Which like there's barely anyone over 30, And
there's a reason for that.
The reality is, there's a lot of factors to that. And as we age, we have to maybe program differently and take more rest days and use lower intensities more and things like that. So we have to always be cautious that we're not trying to take, a square peg and jam it into a circle.
You have to be more thoughtful with it.
Yeah. So, and I think that's hard for people because no one wants, to get older.
Mm-hmm.
So,
Privilege denied to many.
yeah, yeah.
One other supplement that I would say can be really helpful from a magnesium standpoint, and you could probably do a whole episode on all the different types of magnesium, but
That's my number one.
yeah, magnesium glycinate from a sleep standpoint, magnesium threonate from a brain standpoint. There's a lot of great research there, but you know, again, you have to probably have some guidance.
Yeah.
Mm-hmm.
Yeah. I mean, you take too much and you're going to have diarrhea.
Yeah.
It's a supplement that's like, take until your bowels are comfortably loose.
Comfortably.
So
that's like a hard one to overdo, but still, you do need to be aware.
Yeah. And a fun thing with food is like, well, look, this is an opportunity to learn, right? So look up the foods that then have some of these vitamins and minerals. And guess what? They're going to be more health promoting foods. So now, and then include them in your diet. And now you're pushing out
Some
not as health promoting foods and replacing them with you're going to see multifaceted type.
You're going to feel better for a lot of different reasons.
Yeah.
Yes.
Just because
like all of a sudden you look and see, oh, oats have magnesium, and let me swap out my honey bun for some oats, and oh, look, almonds have magnesium,
Yeah.
And then you're eating almonds and oats, and you're also notice your satiety is better. And
fiber and
so both those are of good fiber, and yeah, it's a fun little game you can play. So
I'll make like a fridge list of that would be a fun project.
Like of a nutrient and then like a food that's kind of high in it. I mean, I 100% understand this is not the most of the so most of the population is going to eat what's in their environment and what tastes good.
Yeah.
Right. And then a few crazy people will like be very meticulous and make decisions based off of all that. Right. Yeah. But you can go on Chronometer, plug in foods, and it has the nutrients, and literally like tried to make a day of eating that actually from just food
that hit everything
fulfills all the nutrients. And it's doable,
It's really satisfying to do that.
Yeah. And then
but also the variety of food is really helpful.
Yes.
Yeah. The variety and
standpoint.
What people don't realize is and what's funny, this is when people hate this, right? But if you include so the food pyramid and all that gets such a bad rap because no one actually follows it, right? And if you actually plug in the food groups and foods that they recommend, it actually makes it easier to actually hit all the nutrients. That's the problem when you exclude entire food groups like dairy or
you miss a lot.
Grains or you miss a lot, right? And you have to work even harder to include them. So the reality is by eating a variety of food groups, you can think less. You're more likely. That's why it's recommended to eat a variety. Right. So
you're going to cover your bases way easier.
You're going to exclude, the more attention you need to pay. Mm-hmm. So, and don't get me wrong, then there's also like, you could be celiac, right? You could not be able to
eat
dairy. So yeah, you can't eat those foods. So you're going to have to figure it out. But
yeah, with more exclusion, like you do have to seek out ways to supplement these things because you can't get them reliably in your diet.
Yep. And again, it can be very individual.
Very.
Right? Supplements can be kind of almost like the practices we've talked about as a whole, in that overall, the overarching evidence could say there's no long-term benefit to these. But that could be with the lens of they don't make you live longer. Mm-hmm. But what if they make you feel better in your day-to-day?
Right.
So now you're trying to tell me that like a magnesium pill that's like 20 cents and you sleep better?
Is it worth it? How is that not worth it?
The risk reward is like there's minimal risk. Yeah.
Absolutely. Like if your sleep is off, which it obviously is for everyone when you get older, but like if you're not sleeping well, all of your hunger hormones and all of the satiety hormone, like all of that is thrown off. And so if you're not addressing that, a lot of times that's like the very first thing that I address, because if you're not sleeping well, nothing else is it's an uphill battle for everything else.
Yeah.
Yeah.
And it seems like such a like dumb thing to focus on, but
it's so important.
I mean, when you talk about when you ask people, how they're sleeping or when the last time they got a good night's sleep. It's across the board for the most part is like very, very
And
poorly.
it's only getting harder. Like I saw this thing, they're talking about a generation of like now young kids just don't sleep. Because the reality is, way back in the day, what did you have to do? You go way further back, we didn't have electricity.
Right.
You just had to sleep. There was dark, it was too dark to do anything. Then we had electricity. Maybe you stay up and you would read, right? Or take a stone tablet and write. I don't know. And then, then we had reading. Yeah. Right. You could flip I guess they had like 3 books, right?
Yeah.
It was probably like the Bible. Like,
that was it.
I don't know. Did Albert Einstein write anything on,
I don't know.
Newton? Who those people probably are only like 120 years old. But anyways, then now in this new, we talk about all this massive stuff, our food environment, our the technology environment, electricity. We can stay up and watch TV all night.
There's overload.
Dopamine overload. You can just find things to do, right? And
you could scroll on Instagram for 3 days.
And your melatonin process gets all messed up and jacked up, and you're just literally not sleeping. And then now imagine during the development, those strong development years as a kid, you don't get that sleep. Now, how does that affect you? Then when we're
about to find out.
Menopause 40 years later, right? That could be a factor. It's wild.
Yeah. No, it's funny. Like you can be scrolling on your phone and then finally put it down. And I say you, I mean me. I'll be, I could stay up another hour, but if I go to read a book, I'm out in like a minute.
I know. Yeah, I know.
Right after putting my phone down, where if I didn't put my phone down, it would. And so being really real with yourself about what your habits are and not just looking for a supplement to substitute for that.
Yeah.
Like
you have to have rules.
You do.
Parent yourself.
And
you do.
There's people that will push back and be like, we should be able to be intuitive with all this stuff. And it's just like in the modern world,
our intuition isn't set up for
what we're up against. That's a tough fight, right? So creating some guidelines and rules, and like for me, and I'm a sucker, I'll scroll and I also like to use it for entertainment. But 8:30 comes around, like it's going up. I'm gonna start brushing my teeth, winding down, and go to bed at 9.
I'm gonna start calling you at 8:29.
Yeah, because then it's
problem off.
It shuts off, so I won't even get the call. So for the longest while, I didn't realize when it's on the nighttime mode, you don't get any texts and calls.
Get nothing.
But then at like 5 a.m.,
it all comes in.
It would all come in. I'd be like, man, like I can't believe all these people are hitting up at 5 a.m. But then I realized, like, oh no, wait a second. So
that's why you used to text me back at 5.
Yeah,
that makes sense now.
Yeah.
Like, damn, why is he texting me so early?
So then that's the problem. Like I'm maybe up since 4 and I'm like in a different mindset.
Yeah. You're like, oh, let me respond to all these texts.
I forgot the quarterly people to come, do the AC. And in my mind, I'm like, oh my gosh, they were going to come yesterday. I forgot to unlock the gym. And I'm on my phone at like 6:30. And I text the lady, and not even thinking like, oh no, we'll be. And then I realized like, oh man, I hope she doesn't keep her phone by her bed.
You woke her up.
I hope she has a blocker on and she hit me up at like 9, like a normal person. And she's like, oh yeah, that's fine. But yeah. So yeah, like we just said, and you know what? You know how you figure that out for yourself? Do you need rules and guidelines and how do you navigate the stuff? You hit up someone like Lindsay.
Agreed.
And you let them help you navigate it. So what is the best way for them to reach you or get in contact?
I'm online at wednesdaywellness.co. And I'm on Instagram at Wednesday__wellness and Facebook, all of the above. I'm at Gather. In Newport News, I have the option to kind of utilize their space in Norfolk and Virginia Beach and Richmond as well, which is kind of nice. And I can do telehealth visits for all of Virginia, which is haven't utilized that, but it's nice that I can expand that access there. So again, not like substituting for a regular GYN or primary care, but if you're looking to optimize or just kind of be heard in a different way, my initial consults are 90 minutes long instead of a 15-minute, quick and dirty visit. We look at things, get a comprehensive lab evaluation beforehand and kind of go through things and correlate them to the symptoms that you're having and figure out a plan. So
awesome. And we'll also
love it.
put the links and stuff in the show notes.
Yeah,
as
so
well.
people can go in there. And
Yeah, and maybe if you have questions too, I think you can actually leave questions, or obviously just reach out because this stuff's kind of personal. You're probably not going to want to drop a question on a podcast comment section.
Some people might.
medical advice on it.
Yes.
So, well,
We can also upload some like position statements that you can take, like print out and take to your doctor that they may or may not be familiar with, just as far as like not to, just to show that you aren't just getting your information off of Instagram.
Yeah.
There's a lot of great stuff. But, like,
GPT.
TikTok.
being able to say like these are position statements from reputable organizations and have you seen them?
Yeah. And I'd like to talk about it, maybe.
Yeah.
That's cool.
All right. Well, we appreciate you for listening.
Yes.
Thanks so much for having me.
We'll catch you guys next time.
See ya.